So welcome everyone. Good to see people, or not see some of you, but we will see you later. We'll just give one more minute to let a few stragglers come in, and then we will get underway. But we're very glad that you've joined us on time. Thank you. And of course, there's a lot of people who are signed up and who are going to be receiving the recording of this who are not able to come and join us in person right now. So we're also speaking to them as well. So welcome everyone. Glad to see you. We welcome many Salzburg fellows who've taken part in a range of our programs over the years, not just ones who've been involved in this series. And we see that some people, including those of you who've signed up for a recording of this, are new to Salzburg Global Seminar. My name's Charles Ehrlich. I'm a program director at Salzburg Global Seminar. We wish we were able to greet all of you personally. That's unfortunately not possible due to the pandemic, but we value the fact that more of you can join us virtually, either live or through the recording in this fashion. For those of you who don't know Salzburg Global Seminar, we are an independent, not-for-profit organization founded in 1947 to challenge current and future leaders to shape a better world. For 75 years, whether at our home of Schloss Leopoldskron in Salzburg, online, or in locations around the world, Salzburg Global Seminar's retreat-like programs provide a forum for global exchange and transformation. Our inspiring environment, remote from the day-to-day buzz, allows participants from across the globe to come together and speak candidly, learn from each other, and return to your communities, organizations, and companies with renewed purpose and fresh perspective. Our focus is on tough issues that require cross-sector and interdisciplinary dialogue and the space to step back and explore innovative approaches. We take great pride in convening diverse voices from across generations, geographies, and sectors who would not otherwise have a chance to exchange views with each other. Together, they create outside-the-box solutions and expand their networks in unprecedented ways. Our focus as an organization is on addressing challenging questions that benefit from this dialogue and require the headspace to step back and explore these approaches. We focus on three general areas: the rule of law and social trust, long-term sustainable development, and creative and healthy societies. Today is not one of our usual programs, but rather an opportunity to introduce some of our recent work on an important topic and to invite our fellows working on other subjects and the general public at large to become involved with this initiative and these efforts as we continue to move them forward. We originally conceived of and designed this initiative before the outbreak of COVID-19 in discussions we had with three US-based partners, the John D. and Catherine T. MacArthur Foundation, the Harry Frank Guggenheim Foundation, and the David Rockefeller Fund. We thank all three of them for their support and encouragement as we have moved forward, particularly under the changed circumstances caused by the pandemic. The overarching goals of what became the Global Innovations on Youth Violence, Safety, and Justice initiative were to enhance community safety and cohesion, reduce violence, crime, and incarceration, and transform judicial and prison systems. We thought to look particularly at youth, not just juveniles, but also young adults who have the highest tendency towards violence and contact with the justice system, and to see if we might not address the root causes. We saw that in many countries, there's growing recognition that effective criminal justice reform needs to look beyond the usual toolkit and institutions of the criminal justice system itself. We also recognize the pivotal contribution that global exchange could make to criminal justice reform efforts, including the seeding of new strategies around the world. We started with the purpose of the criminal justice system, understanding that the power a government exerts over citizens must be legitimized. Therefore, we set out to explore examples of where culture has changed from heavy policing and incarceration systems, the custody, control, and suppression models, towards a focus on human dignity. This approach has included top-down system overhauls, as well as bottom-up community-level interventions. Because of the pandemic, we ended up doing all of our meetings online in 2021. We ultimately brought together 67 Salzburg Global Fellows from 19 countries into small interlocking working groups. We look for points of intervention and big, potentially transformative ideas that can help shape the future of criminal justice systems. In addition to just mixing people from backgrounds traditionally engaged in criminal justice, we also have brought in fellows from education, health, business, the media, and cultural spheres. The rich learnings from our workshops throughout 2021 are summarized in our report, and a link will be posted in the chat if you haven't seen it already. For those of you watching online and not here with us live, everything that is going into the chat is also going to be put up and linked on the YouTube and on our webpage links so that you can see it there, and we realize you can't see the chat from home. The report is designed in a web-based format to be accessible so you can dive right in. It has developed summary key takeaways, examples, and recommended resources. And we will continue to highlight those examples through short reports, interview features, social media stories, and videos with our fellows. And there's a video that is out, if you haven't seen it already, about 5 minutes, where 3 of our presenters today are featuring. The next phase of this multi-year initiative is where we are right now, which is a series of public webinars in which we are identifying some of those promising global examples of violence reduction and criminal justice transformation proven through research to be effective, viable, and replicable. These may not be the answer to all questions, but we hope they inspire you to think about alternatives that you might adapt where you live and work. We invite policymakers, public officials, activists in positions able to spearhead new reforms to join us for the next round of conversations and actions starting later this spring. Today, we're examining public health approaches to justice, or the whole systems approach, as some people prefer. We have 3 illustrious leaders of our discussion today: Maureen McKenna, Geeta Subramaniam-Mooney, and Jacqui Dyer. And you'll be able to see their bios as well, their full bios in the chat. How to ask a question, I'd like to say that please use the chat, put your questions up in the chat box. We won't interrupt the original presentations at the beginning of this webinar, but we'll call on you later during the question and answer session. And if you want to get in a dialogue in the chat, that's also very rich and rewarding as well on the side. And so we encourage you to keep posting throughout. And with that, with no further ado, I would love to hand over to Maureen. When we started this initiative and we were looking for the best examples of transformation and real change, everybody kept saying Glasgow, 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 Glasgow. And so we went straight to the person who spearheaded many of these reforms for the last few years in Glasgow, and it has been such a delight having her as part of this group and sharing her experiences, which she will share with you today. So Maureen, over to you.
Thank you very much, Charles, and thanks very much for giving me the opportunity to speak today about Glasgow, my home city, and a city that I love. And I suppose a little bit to start off with about the context. I mean, the city that I grew up in was a dark and violent city. It was famous for its ganglands, knife violence, poverty, and poor living conditions for our families. But with all cities, it has another side. It's got a city of wonderful architecture and wonderful people who are, although I'm a little bit biased, are the friendliest I've ever come across. And over the years, the City Council has radically improved the housing in the city, and Glasgow has become known more for its arts and culture and its success as an international sporting venue. So therefore, when I came to the city in 2007 as Director of Education, I knew that there was huge potential to really make a difference. The city continues to have high levels of poverty. We are an increasingly diverse city with over 140 languages spoken. However, these need to be seen as assets, not deficits, and it's important always to take a strength-based approach. So, for example, there was recognition across services, I think as Charles was saying, that the traditional ways of dealing with violence were not working. And so the development of from the police of the Violence Reduction Unit, taking that more holistic and strength-based approach, recognising that you had to address the source, not just the outcome, and seeing criminal activity more as that public health issue. But essentially for me, this is a rights-based approach. It's about the sustainable development goals, and for me, it's that sustainable development goal: every child has a right to an inclusive education, regardless of their context. And our vision in the city was to use education as the means to reduce the impact of poverty and to work with families to give them that hope and aspiration. Families who historically had more of a sense of hopelessness. And so, of course, we couldn't do that on our own, and we worked with a range of partners. And it is that holistic public services, a public health approach that has made the significant difference. So working with the voluntary sector and other public services, but for me, it was about keeping education at the centre. And one of the first challenges we faced was that far, far too many young people were being excluded from school, either formally, through their poor behaviour, or informally through an unwillingness on their behalf to come to school. And I recently looked back at some statistics, and in 2006-07, one of our secondary schools, around about 1,000 pupils, had 770 exclusion incidents in 1 year. Now there's only 190 school days. So every day, at least 4 young people on average were being excluded in that school. Last session, that school had 13 exclusion incidents in the whole year. Now, I don't have a formula to share with you on exactly how that was achieved, a programme that could easily be replicated across other schools, but I think there are some core principles which can be adapted and would work in any system. We've worked exceptionally hard placing young people at the heart of every decision, and that may sound a little bit obvious, but actually it's much harder than it sounds. It means that you need to understand the needs of each and every child, you need to understand their context, and you need to be adaptive in the ways in which you respond to them. And we used nurture as our hook. We set ourselves the ambition to be a nurturing city. We use nurturing principles to underpin our work, and we constantly remind ourselves of the importance of the rights of the child. And the most transformational principle has been all behaviour is communication. This nurturing principle has allowed staff to understand that when a child kicks off, it's not necessarily because they're being bad, rather it may be their means of communicating distress, and therefore punitive measures may not have the required impact. It means that we need to listen to the child and work with them and their family to try to resolve issues. Restorative approaches are very firmly at the centre of what we do in our schools. And this means that we've had to invest in professional learning for all of our staff, teachers and support staff, but not in a one-size-fits-all approach, but each school understanding their context and where they are on their journey to be as inclusive as possible. Young people need to be absolutely involved in this. They need to be engaged in the decision making. And that doesn't mean just having a pupil council that decides where the bins go in the playground. It means having young people positively influencing the life of the school, leading their own learning and their views sought on what works for them at classroom level as well as at school level. And equally, their views sought on what went wrong when there's an incident and what we need to do to help them improve and to make better decisions. And too often in our schools, it's about that power imbalance between the adults and the young person. And what we've tried to do is to improve that balance. The emphasis has been on helping young people make good decisions. So if you make good decisions in school about your actions, and you're able to reflect, think positively and be confident about your future, then you will take these skills out into the community. In the last 10 years, youth violence or youth crime in the city for 10 to 16-year-olds has reduced by over 50%. I mean, we've had amazing success, increased attainment, more young people than ever going to college, university or employment when they leave school. But that doesn't mean we've fixed the problem. This is something that we will always have to work on. The pandemic has set us back. Young people have suffered without the routine and the structure of school life. And we still have serious incidents that happen. And we had one last October where a young man lost his life, a 14-year-old boy. And I do think that COVID and the whole lack of structure has impacted on that. Many of our young people don't have settled home lives, and they've missed the link with their one good adult that we all need to be successful. Relationships are absolutely at the heart, and we need to rebuild the supportive structures that were in the community. Youth services haven't yet fully returned. Self-isolation times and uncertainty around exams is impacting on young people's attendance at school. They are uncertain about their future, and we mustn't underestimate the negative impact that that has on their well-being. So this is the time that we need to refocus again and again, and we need to be even more tolerant and understanding of young people's context. This is the time that we need to be more adaptive and more inclusive more than ever. So Glasgow it's a fabulous place. I think we've done wonderful work, but my goodness, we still have lots and lots still to do. So I'm really looking forward to listening to Geeta and Jacqui now too, because we are always learning and we will never reach the end of our journey. Thank you very much.
Thank you, Maureen. I'd like to pass over now to Geeta Subramaniam-Mooney, who's the first Futures Commissioner, or Brighter Futures Commissioner for the Borough of Newham. So she will give us a little introduction to some of the work that she has been doing, and she has pioneered there. I realize this is a very UK based day. That is intentional. We think there's a lot of lessons to be learned from the UK, and there's a lot of discussion on these areas in the UK about a whole systems approach. And Geeta will be introducing the approach that she has taken. Geeta.
Thank you very much. And it's been a huge privilege working with all the fellows on the report and just learning from all over the world about what's going on in the space of the public health approach. And I also have been very lucky to have met Maureen very, very many years ago and actually went to Glasgow to see the public health approach in real life. And I think it's only when you really see and understand what Maureen talks about as a cultural change that you fully understand why you go on this journey, and the journey carries on for a very long time. And I think so my first reflections on the whole systems response or public health response that we have been taking in many parts of London is really about firstly understanding what we're trying to do, what's the outcomes we're trying to achieve, and what does that look like for our children and our families. And I think that focus on outcomes response is that thing when you get challenged about, well, that doesn't sound like it's going to have an impact, or that sounds a little bit kind of loose, and really is it going to achieve the things that we want to? And obviously for us, outcomes for children in terms of healthy, happiness and staying safe and being able to reach their full potential is ultimately why we do what we do. So I think that would be my kind of first core nugget of where I think we need to start. The second one, and I think it shows with, you know, both Maureen and Jacqui and many, many leaders that I've come across, is that if you do not have that strong local leadership, you don't get the movement, the investment, the culture change, and you don't get that real full buy-in into why we're doing what we're doing, and we're going to do it for 10, 15, 20 years. And if I can't underestimate the strong local leadership that is required. And at a London level, we also have a strong regional leadership, which very much marries the public health approach with our violence reduction unit and what we have in England as police and crime commissioners, who have that responsibility to think about how we're going to really support youth safety in this example. The next thing I would say is data and evidence and what works. And if there's anything that I hold on to is that you have to have data, whether it's really telling us all the things we need it to is a good challenge. Have we collected the right data? Is the right data going around all of our partners? All really important. And also to be really honest about data. So is the data telling us something we feel uncomfortable about? And, you know, again, many of my colleagues in the UK, we talk about stop and search data of the police. And we know that it is disproportionately impacting on our young black men and boys. And we say that because the data tells us that. we then are able to ask the questions that sit behind it to then try and resolve the issue, rather than just using data to paint a kind of picture of the things that we think might be useful. But evidence is important. And again, in the UK, we've been working on a youth endowment toolkit, which has showcased a number of things about what works. It's not the complete novel. It works on the evidence that we have seen across the world. But of course, there's a lot to learn, as Maureen says, and every time we do things, we try things, we put things in place, we're learning and building on that evidence base. But there's a lot in there that showcases what works in terms of violence reduction. And then linked to all of that, I would absolutely say, as Maureen has also said, if we do not genuinely listen and hear from our children and our parents and our communities, we are just doing the things we think will work and will have an impact. And there's nothing worse than having a blueprint for something like this that you then just try and lift and shift from another country and put it into your area. You have to think about the kind of system things that are core nuggets that you bring across. And then what's the recipe for your local area? And, you know, does that mean you have more eggs and less sugar in South London, and you have more, you know, flour and more eggs in East London? And it's really important that we don't think there is the golden nugget that resolves these issues. And then my last kind of core element, I suppose, is to say that there is nothing more important than that learning and that real investment in having a systems change approach around what Maureen talks about, nurture, I talk about in terms of trauma informed. So we know that the impact of trauma on our children and our families is significant. That may be trauma in terms of life experiences. It could well be racial trauma, as we are experiencing significantly previous to COVID, but also now through COVID, we've seen the inequalities that have absolutely amplified those risks and issues for our Black, Asian, and our ethnically diverse communities. So if we don't invest in that trauma-informed lens, the restorative practice, the way in which we actually see children and families, then we are not consistently thinking about what that behaviour is telling us. And if we don't do that, we don't open our eyes to that, we are often actually quite blind to what's going on with those young people. And we are often then putting them through systems that are absolutely unhelpful and actually sometimes damaging to them. So I know I see in the chat, and I asked Antonio to just put these up. There are two images that I use when I just talk through the whole systems response, because I think they're helpful just to galvanise what we think are the different points of prevention. Prevention often is seen as that sort of really early stuff that if we, you know, the first 1,000 days of a child's life, if we do that really well, whether that's health, whether that's in terms of school readiness, through what we have as children's centres and nurseries, if we do that really well and we support our parents and children in their early formative years, we have really set up those young people with some of those strong empathy building and bonding, the kind of real resilience features. But we know that that's not always easy, and there are lots of things that go on for our children and families. That means often they are so far behind the starting line that actually some of those formative years are really impacted by what's going on in their environment. So for me, when I talk about primary prevention, I equate it to a heart disease. So we know if you do diet and exercise, you have a healthy heart. So in terms of youth safety, I always talk about what is the equivalent. And the equivalent for diet and exercise is those formative years, but it's also thinking about place. And in local government, we have a real opportunity to shape place with our communities and with our people. And when you think about neighbourhoods, how young people and families feel, what does that feel like when I'm an 8-year-old navigating the borough? It's very different to me navigating the borough. So when we're shaping place, we have huge opportunities to not just think about safety, not lights and cameras and all the things we would normally think about. What is that real feeling of investment, of social cohesion and community development that we build from building place and with our families and our children? And of course, as I said, if you build those resilience factors for our young people around school readiness, you know, where are our children learning critical thinking skills? And are we really building that sense of resilience, safety, as well as English and maths and all of the things we know are core skills for our children and families? But thinking about our parents in that role, you know, nothing in COVID, you know, my own daughter, you know, having her at home and learning at home, Parents are the first teachers of many things. I didn't think I'd have to go back and teach English, but you know, you learn these things. And I think we have to think, what's the community to teach our children and our families about some of those core skills? So I'll quickly move on to secondary prevention, because this to me in heart disease is you have high blood pressure. So what do? We medicate. And in terms of youth safety, the high blood pressure point for me is a couple of things. These adverse childhood experiences that we know internationally has evidence that if you have these adversities, so it may be domestic abuse in your family, a parent with mental health or substance misuse, or a parent in prison, or a number of things that adversity affects our children. But these are not insurmountable, but they are indicators. So where do we find the support at that early point that means our families and our children are getting the right level of support and advice at an early point? Linked to that, excuse me, linked to that, I would talk about the trauma and the impact on the brain development. Because actually we know that trauma physically affects the brain development. So a 3-year-old's brain is usually so big, a traumatized 3-year-old's brain is this big. And so what you've got is actual really developmental cognitive development concerns. That means our children are often in this fight, flight, or freeze phase. And what that means, if you think about it in a community safety perspective, our young people are in a hypervigilant state where they are either completely in that fight mode, or they are completely in that freeze mode. And what that means is that they're not able to do some of that critical thinking, to think about what are the things that I need to be able to do in these situations that may be very difficult in my family, in my neighborhood. So then moving on to tertiary prevention, this is the thing about, you know, preventing further heart attacks. I've had a heart attack. I've become known to systems, and in youth safety terms, we know these flags. You know, Maureen's talked about exclusion. It is a significant impact on our children when they are excluded, not just from school, excluded from society, excluded from youth services. There are lots of places our children are excluded, but also those young people who have special educational needs. And are we really understanding what those speech and language and communication issues are that mean we need to sort of think differently about our responses? But we also know children who go missing. In England, we have unfortunately been dealing with county lines for a good part of what I would call probably 10 or 11 years now, where young children go missing for long periods of time. And unfortunately, they are being groomed to deal drugs. And those missing indicators are significant. So when you see those indicators, what is the dynamic flags? What are the things we need to do to try and prevent further heart attack, further harm that's being caused to our children? And so what we have is, of course, packages of support, of multi-agency response. We have things like youth offending services in the UK. And we also have, you know, our policing service with our voluntary community and faith sector and the local authority, all working together to try and protect and reduce the harm that's being caused. And then finally, I will just say that, you know, the critical management piece is the unfortunate end of the system, where, of course, you know, young people are being harmed. They are injured or unfortunately lose their lives. And the children who are on that escalator up towards that end of life-changing, life-threatening and actually detrimental impact, it is for all of us to make sure that we have the right enforcement tools in place. Our police do need to play a role, and they do, in terms of making sure we arrest those dangerous individuals, that we take the right disruption tactics, because actually it is adults who are grooming the children who are causing the harm. And if we don't have this whole systems response, all of those things working well together, we won't be able to say that we have got the right response at the right time for all of our children and families. And I'll finally just conclude that there is another illustration that you will see in the chat, and there is nothing more important that all of us, whether we are a statutory agency, a public service or not, to agree the philosophy, our approach. And the reason I say that is that you can come up with lots of terms about whether it's nurture or whether it's trauma informed or whatever the different language is. We have to agree it. And if we don't agree it, we therefore, when we take a step forward, we're not moving together. We are not making progress, and actually we are being quite difficultly detrimental to the whole system's response. And the tree that you will see in the diagram for me is, let's pick up some of those critical ways in which we want to behave. as professionals, as local communities, our behaviour, so we are restorative, we are non-judgmental, we are trying to find solutions together. We don't see children as difficult and dangerous and awful. We're really genuinely all together saying children have a right. They have a right to a good childhood. They have a right to fun, and they have a right to not be harmed. And actually, if we all agree to that, the principles and the way in which we work then follow. And as I go back to where I began, if we think about those core foundations of what we need to build a public health response, and we do it consistently, sustainably for a long period of time, you will, and I do believe, we will see a big difference in terms of the impact on our children's life chances. Thank you very much.
Thank you, Geeta. And just to remind people watching not live, all of the slides that Geeta was referring to that she posted that were posted in the chat are available on the website and linked from the YouTube. So so you can see those even if you're not here live, able to see the chat. I'd like to hand over now to Jacqui. Jacqui, Dyer is going to tell us from a different perspective, because she has a compelling personal story and lived experience which has encouraged her to get active in politics. So she's coming not from the civil service side of things, but from the politically active side of things, and why she got involved and how she's gotten involved and what she is doing in Lambeth is worth highlighting. And I will hand over to Jacqui to explain.
Hello, can you hear me? Thank you very much, and thank you very much for the Maureen and Geeta. I really enjoyed your presentations, and much of what I would attend to would be including a lot of features that you've already talked about. So I'm going to think very carefully about trying to add value to this discussion rather than being repetitive. So from the perspective of lived experience, I would say that in my own experience with my siblings, particular siblings suffering from severe mental illness, and his experience as a very vulnerable adult at the mercy of crime and disorder, I would say, impacting on him, was a very, 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 very painful journey to experience. He's now passed, but it kind of helped me to really understand that I need to pay deeper attention to this particular aspect of what takes place within our communities, having such a personal impact of when this area is really not attended to. In Lambeth, there is particularly an overrepresentation of people from African and Caribbean communities within our criminal justice system, be that in the youth offending service, which actually, for me, even the language that we use is an issue. So for me, the youth justice service, and we're looking about actually changing our language to be more rights-based and more empowering, which therefore kind of reflect a different kind of analysis and understanding of the causal factors and features that create the conditions that many of our communities are living in, that then catalyze some behavior which is not helpful for them or for the communities that they're located in, is one thing. And the overrepresentation of African and Caribbean communities in the mental health system, in terms of in inpatient settings, at one end, the lack of access for our children and young people to appropriate mental health or emotional and well-being support at earlier points in the juncture, in their journey, to support them in terms of their emotional needs and well-being. So building up, in a sense, some of the features that then create crisis at an older point in their life journey. We're not attending to them as well as we could. And the overrepresentation of children in our children's social care services of a statutory nature, because a range of their needs are not being met. But also that we have, in terms of their families, overrepresentation of African and Caribbean women that are experiencing domestic abuse, for example. So for many of these children and young people, they're growing up in environments where some of these features are also taking place. So that holistic approach in terms of understanding the whole family, because most of our children and young people are not growing up in isolation, they're growing up within family context and a community context, and being able to thinking that holistic kind of way is absolutely really vital. So I think that from understanding that actually quite a lot of our public purse at the local level is being spent on our overrepresented communities from either exclusion or detention kind of dimension, requires a different understanding of what's going on. That means that this crisis sort of experience is the norm, actually, and that has been going on for many years, if not decades. I am in the borough of Lambeth, and this has been going on for many years in terms of what the data is showing, without the attention to understand, in my view, what the structural and the systemic issues are that create a set of circumstances where people cannot flourish, where people cannot thrive, where individuals cannot flourish, where individuals cannot thrive, because every aspect of their world is so challenging and so difficult that there's no way out. And so in terms of how we're attending to that, understanding the systemic and structural issues, is that we're paying attention to the housing element, because many of our families are in overcrowded circumstances. Many of our families don't have access to food on a daily basis, healthy and nourishing food. So addressing child poverty is a priority for us. Looking at employment and education opportunities from the cradle to the grave, and making sure that we're building into our assets that are in the borough, attention to their contribution to providing opportunities for employment, apprenticeships, work experience, different ways that we can drive forward additional resource and alternative existence for children and young people and their families, their parents, for as early as possible and as systemized as possible, so that all the assets within our borough, London is one of the wealthiest cities in the world. How is it contributing in terms of big businesses, our anchor institutions like our hospitals, our academic resources? How are they contributing to making sure that the populations that are located where they're located have access to these opportunities and don't feel so excluded from the wealth that is generated all around them, and that they're not a part of that? So for me, looking at the systemic and structural issues as in terms of what I call a holistic approach, which maybe some call a public health approach, is absolutely fundamental here. There is an socio-political economic context that people are operating within, where systemic oppression, systemic racism, systemic disadvantage operating as dynamics that are getting in the way and undermining their abilities to navigate and flourish in their environments. And so for me, that is really important, particularly in the context of COVID, where we've, and George Floyd, where we've realized even more so that these are the realities of many of our people's lives. We don't want it to be so. So politically, I make sure and lobby for and work with my colleagues to create a set of local policies that help to attend to this holistic approach to changing our children and young people's lives and creating opportunities, pipelines and pathways for whole families as well as individuals to flourish and thrive. That's what I would like to say on this.
Thank you, Jacqui. It's a lot to think about. I wonder if I might first flip to the a question to all three of you. And Geeta, you were saying the data, how important the data and data gathering are. So you've had innovative approaches which are slightly different in each of your three jurisdictions because they're three different places. But I wonder if you could share concisely what the data are showing. How do you measure the success that you've had, or if you've not had success, what have you done to get better data that will one, enable you to measure the success, and two, prove that you are having the desired impact that you've set out to achieve? Geeta, I'll start with you, and then Jacqui and Maureen.
Thank you. So I guess the first thing I would say is there is a sort of well-known kind of technique, which is the theory of change. And if we adopt that, the outcomes that I sort of mentioned before about happy, healthy, safe and thrive, that's what we're trying to achieve over this side of the page. And then what we need to do is to say, it's not just throw loads of actions together, because we could be doing 1,000 things, but we don't actually know if those 1,000 things are having the desired effect. So I always use the go back to the evidence base. What is the evidence base that says, for example, what works in terms of young people transitioning from primary to secondary? Well, there's lots of evidence around mentoring that supports the young people that may need some additional support through that transition. So think about what the evidence tells us, and then you use the data. And data for me is a couple of things. Of course, we need to measure, has violence reduced in terms of, knife crime under 25, overall violence in terms of the borough, homicide rates, all of the sort of crime types you would expect. That is a definite data set. But what's also important is to say, of the children that have gone through some of these services, what has been the impact? So, we talk about youth offending, youth justice services. Jacqui is absolutely right. Young people who are in the criminal justice system, what impact has that had? Have they reduced reoffending? Have they got into employment and training? What are some of those positive, strength-based data sets that we'd want to look at? And then finally, for me, because I always do that, go back to the very early prevention, have we got every single one of our children? Have they been seen by a health visitor? Have they had their basic immunizations? Have they, been able to get themselves school ready? So some of those really core fundamental foundations of a child's life for me is the measures. And when you put those measures together along the life course journey of a child, and you think about some of the activities and things we do against those things, that's when hopefully with evidence-based, revising, reviewing and learning, that you should be achieving those outcomes that we set out for ourselves. But from my perspective, there will be data that is not positive. Like I mentioned, the stop and search data, and in the same way, crime, violence in London for teenagers is significantly higher and is an issue for us. And so we have to always reflect to say, have we got some of the right pillars in place? Have we got the right measures at the right time? Not to knee jerk, but to really sort of challenge ourselves about the approach that we're taking, using data to inform it. Thank you.
Jacqui?
Yes, so in addition, And that's quite right. I think one of the things that we are really trying to cultivate, and indeed in developing our Lambeth Made Safer strategy to address the violence that impacts on our children and young people, and our violence against women and girls strategy, data has very much sort of informed our strategic approaches, and the work streams that have emerged from those strategies very much are informed by data. In addition, what we've cultivated is that our communities who co-produce both of these strategies, along with our range of stakeholders across statutory sector, have an ongoing engagement with us around how, because crime and disorder in general is very much a priority within our borough, but how are we in an ongoing way working with our communities to co-implement these actions, to co-design these actions, to co-deliver these actions that they prioritize with their expertise, their lived experience expertise located within communities that then interact in a ongoing sustainable development way around addressing some of these concerns. So that's kind of how we've systemized working very much with data, but with our stakeholders and our community engagement. And the other element around data is that actually it's an ongoing process of looking for what constitutes evidence, actually what additional sources of evidence can we bring to the table, and how are we cultivating developmental evaluation of all of the work streams that it is that we're doing, so that there's almost an ongoing plan, do, study, act kind of cycle taking place, where we are constantly learning, moving away from what doesn't work, more agilely towards what is working, and that there's shared ownership around that. And one of the ways that we've ensured, because of the absolute ridiculous overrepresentation of our Black communities in these spaces, is that we've got a research partnership with our academic partner, King's College London, and Black Thrive, Lambeth, working to develop and support both the evidence base and the research and the evaluation to support the works that we're doing, so that within the 10-year life cycle of our strategy, actually, we are more likely to be really successful than otherwise.
Perfect, thank you. Maureen?
I suppose just briefly to pick up on both Geeta and Jacqui's points, but you need to, I speak as a maths teacher, by the way, who loves numbers, love graphs, but you have to make the data work for you. You know, we've got oodles of data, you know, there's screeds of it online on every kind of data you can imagine, but are we really using it to change our actions? And, you know, using it to inform what we do next. And if I give a little anecdote, so I collected all the data on exclusions, and I did it month by month. And I've stopped doing it. I stopped doing it a few years ago, month by month. But what I would draw a lovely little line graph and share it with everybody. Everybody got to see everybody else's data. We did it by school, we did it by the city. But what it told us was that you were most likely to be excluded from school in November and March. And then we asked the question of our schools, why? Why are you more likely to be excluded in November and March? And if we were all in person, this would be my question out to the audience, and I would be like a good teacher. I would be finding somebody pointing at them to give me the answer. But actually, if you take a Glasgow context, it's November. When it's November, it's dark, it's rainy, you're going to work in the dark, you're coming home in the dark. So actually, are we excluding young people because they needed to be excluded for their own safety or for the safety of others? Or were they being excluded because I was tired and crabbit? good Scottish word, is that the reason why? And actually, you know, that it's about changing behaviours. So you need to use the data, and there's oodles of it out there, but you need to use it purposefully.
I will put in a plug that in 13 days, so not Thursday, but Wednesday in 2 weeks, the next webinar is on data-driven criminal justice reform. So the importance of data is absolutely key. We try to keep these webinars rolling in a logical sequence. And so that will be the next topic. I'll mention it again later. But I'd like to hand over to a question from Haidar Muntadhar, who's also based in London. He works in countering violent extremism. So he comes at this from a slightly different angle. I'll let Haidar ask his question himself. Haidar, you can turn your camera on as well.
Unfortunately, I'm only going to unmute myself just because I'm in the middle of a move. So to prevent everyone from seeing my boxes, I thought I'd get that. So yeah, thank you very much for introducing me, and thank you very much to all the speakers. It's been a really interesting conversation. So as Charles mentioned, my role is within countering violent extremism and prevention of terrorism. Although in Croydon we have adopted the violence reduction model and the public health approach, and it's something that I've really championed, especially in my very weird particular field of work. My question is that in adopting the public health approach, what are some of the unique challenges that can present itself? You know, two things that I'm particularly concerned about, and something I've seen from my experience, is that when there has been a spate of attacks or high-profile attacks, there have been some who have advocated for more heavy enforcement measures, and it's about communicating to them why that could be counterproductive and counterintuitive, etc. And the second would be perhaps that there is what I would call a creep from enforcement to turn the strategy to become more enforcement centric. And how is it that you would prevent that from taking place, and kind of, you know, understanding and appreciating that there is a role for enforcement, but for it not to degrade the public health approach that's been put in place. So it's a great opportunity for me to ask this question because of your wealth of experience. And so back to the basic fundamental question, which is what are the unique challenges that can present itself within the public health approach?
Who would like to take that? Maureen.
I'm happy to come in first. I suppose the big challenge is about the range of people that need to be involved, the range of people and agencies and services that need to engage and work together with the same kind of philosophy and the same kind of culture. And you know, the violence reduction unit, when it first started in Glasgow, spent a long time out talking to partners, and building that sense of purpose that we all shared. And there were, you know, a lot of challenges, people who wanted, and there are still people who want to shoot straight to enforcement. But, you know, I suppose I'm preaching to the converted, isn't it? That you go straight to enforcement and it's short-term gain. You know, there's lots of very good evidence out there that shows that you build those alliances, you build those partners, you put the child and the family or the young person absolutely at the centre, and that's where you get the longer term gain. And the other challenge is there are no quick fixes in this. Change takes time and we need to be patient, and that's a real challenge with politicians, you know, who rightly are thinking about, you know, their period of office and looking for a difference. But in Scotland, 14 years ago, when I first became director, Scotland was discussing increased secure establishments for young people. We didn't build them and we don't need them anymore. So, you know, we now have an unbelievably strong evidence base that this is about longer term outcomes. And it's about, you know, Jacqui spoke about it, about raising those aspirations and giving those young people and families hope and purpose. And for me, of course, as you would guess, that is through education. That's what makes the difference. And that's some of the challenges that we would have faced. I'm sure there are others from other perspectives.
Geeta.
So I absolutely agree with everything Maureen said. And just to add, I think some of the other challenges is financial. I think we have to be honest that to do some of these things really well, you need committed financial investment across the system. So, you know, I think, and again, Jacqui will you know, say this, that there's been a lot of conversation about those universal provisions such as, you know, informal education and enrichment opportunities and all of the things that we know need to happen as well as education in school. And, you know, in Newham, we've really invested in those provisions. You know, we've doubled our youth hubs. We've really thought very hard about some of that kind of cultural sport and, you know, the tech opportunities that our young children today need for moving forward into a future of employment and, you know, and all of that kind of rounded life skill stuff. So I do think money is an important barrier and needs to be stated, but it's not a reason for why we shouldn't do it, because there is also a question, I suppose, about how much more effective can we be when we come together. And, you know, if we don't have that agreed philosophy and the way in which we do things, we don't always come together to use our resources, whether it's money or people, in that most effective way. And then just in terms of the question and the particular area that Haida works in around, you know, I guess the challenges of counterterrorism and prevent, I think that when you look at the public health approach and perhaps some of those very stark responses that we do see when we have awful incidents in terms of what happens in our country, I think there is a really important point that our police are there to keep us safe. And I think sometimes enforcement does get a kind of slightly negative tone on it. And you know, Charles, through the work we've been doing on this report, just meeting some of the people from around the world and some of the real challenges that I think I'm shocked at, actually, in terms of what happens in policing in some parts of the world, that we have got a difficult policing service with a lot of challenges. And you know, all of you will have read the news about the challenges in the London Met Police at the moment, which I think are really significant and need emergency responses to resolve. But our police are there to keep us safe. They come to keep us safe. There are challenges of trust and confidence, which Jacqui has talked about, but we can't not do enforcement. And when I was speaking earlier, if we don't do all of those things and really enforcement to arrest the most dangerous people in our communities who are harming our children, then we won't be able to do all of these things that we talk about. So that's not me advocating for prison. That's me saying that we have to do a bit of all of it. But go back to, I think there's a question in the chat around the children's rights bit. You know, everybody, a police officer, a youth worker, a teacher, and anybody else needs to see the child first. And the child has a right to be a child. And that means when we do look at enforcement, it's through that lens that you have to think about the vulnerability, the child is being exploited, and therefore what is the right multi-agency response for the child, and use enforcement to tackle the most dangerous individuals in our society.
Jacqui, do you have a comment?
Only that I think we have to sometimes like disentangle what it is that we mean by a public health approach. And sometimes I think that there are assumptions that are loaded into some of the terminology that we don't necessarily make transparent. And I just think that that would be relevant as well. But no, I think that a lot of the territory has been very much explored.
Great, thank you. Geeta had referenced something in the chat, which is a question from Margaret Hanna, and I'd like to invite her to just pose the question. If not, I can read it if you prefer that I read it. And I will pair your question up with something from Jennifer Dunn, who's joining us from Edinburgh, who also has a question. I think that can be answered together. So Margaret first, and then Jen.
Thank you, Charles. Can you hear me all right? Yeah, great. Okay. I've been fascinated by this conversation. A little bit about myself. I've had 25 years as a consultant in public health and in the later years a Director of Public Health in Scotland, but since 2018 have been focusing on work internationally around child health in particular and child mental health, and a resource called Kitbag, and I can give you details about that in the chat afterwards. But my point about this is about culture shift, and the points that have been made by all our speakers are incredibly pertinent, and I almost feel I'm not really adding much by putting my voice in here, but just to say absolutely, Jacqui, about different ways of thinking about public health itself fundamentally does change how you go about this societal issue. But also my actual question was around, you know, why did we just start from the centre of the need? Where does the need come from? It comes from the child and the child's life, their context, their perspective. And you know, we have done a lot of work in Scotland around child rights. Delighted that we've actually got it passed as a principle from our Parliament, that children's rights have been signed off as important. But the real question is, so what does change when agencies and staff working in those agencies genuinely listen to the child and genuinely work with that child and its family in their context? What starts to change? And you know, what gets in the way almost of that perspective, not driving the decisions that are happening every day in our lives, which clearly is really where we need to go next. Sorry, I'm waffling a bit there, but that's kind of my question.
And a related question from Jennifer in Edinburgh. Are you there, Jen?
I am, sorry, Antonia was stopping me talking. Hi, yeah, I'm Jennifer. I'm based in Edinburgh. I'm also work at Salzburg Global Seminar. That's why I'm allowed to make fun of Antonia. And I've just also begun a master's degree in spatial planning and urban design. So I'm quite interested in a lot of these issues, particularly. Yeah, I think what I'm interested in exploring relates very much to what Margaret just said, and I thought that was another way of kind of looking at it. But I think at an individual level of a person in this system, there are a lot of prejudices essentially that exist that when people are dealing with these issues. And this is something I've been thinking a lot about, particularly in the kind of built environment example, where, you know, we have a lot of these ideas about, yeah, we should be doing this and it should be human-centered design. But what does that actually mean when you look at it? Well, that means you have to put this human at the center. And there are, you know, I think a lot of the time people know that they want to do something good, but the reality of what that looks like really means, you know, treating everyone as if you want to, you know, you want to improve everyone's life, even these communities where it may be more difficult, or maybe people that you somehow are just viewing differently. And so I suppose, I guess my question is, on a practical level, how do you deal with these prejudices on a daily basis and kind of going from that like wider idea of values and making sure that individuals really explore what that means for them, if that is logical as a question.
Maureen, would you like to kick off on this one?
Thanks, Charles.
Scottish questioners, so Scottish answer.
Oh, nice question. I think, I suppose it's about, I suppose if I take the prejudice bit first, to change people's minds, to change their mindset, it does take time, but you know, I did it within the context of teachers and support staff, and teachers, and I speak as a teacher, are some of the most judgmental people in the universe. And they, you know, they sweep just a little bit too quickly to being past remarkable about absolutely everybody. And I think, you know, it's about, you know, I talk to our newly qualified teachers every year, and I talk to them about not being judgmental, about understanding that our families have a lived experience that perhaps is not the same as our lived experience. And therefore, you know, we need to learn how to walk in other people's shoes. And actually being explicit about it, and then calling people out when they don't. And you know, too often, particularly in staff rooms, in company, people don't call each other out. We acquiesce and we just say, you know, you just kind of go with the flow. But actually, if you're truly going to be child-centered, family-centered, then that's, you know, you need to do what it says on the tin. You need to keep pulling it back to what's the needs of that child. And is it right for me, when I don't have that lived experience, to pass judgment on somebody else? Just because they don't live in, or they live in poverty, or they have a different color of skin, it doesn't matter. And we in leadership roles need to lead from the front and need to challenge and speak out about these issues. And I think the rights-based approach gives a very strong framework. You know, we're a small world now. So therefore, the UNESCO rights of the child are goals for us all. And you know, I love them because they're very straightforward, they're straight to the point, and you can find them everywhere, and everybody should be able to identify with them. And you know, what's not to argue with? But the challenge is you've got to be able to not just talk the talk, but you have to walk the talk. And that's for each and every one of us to face that challenge. And often for me, you know, when I hear people moaning, you know, I'll say, well, whoa, you know, let's not talk about if only they did this. Let's change it to what should we have done? What could we have done better to address that issue? So, you know, you need to flick it back on ourselves. What could we do? Not what could they do? It's for us to help make the change. Don't know if that's answered your question.
Can I
Jacqui.
Yeah. And just to build on that, I think that when I talk about community engagement, because the rights of the child, keep the rights of the child, keep the voice of the child central. Now, how do you do that right across the piece? If we're thinking about a holistic approach, it's not just in the location of where you are directly interacting from a youth justice perspective, but it is in relation to all aspects of that child's liberty. So how do we make sure that the child's voice, the voice of those diverse communities that are experiencing differential outcomes, are actually involved every place where it's possible, that might assist influencing the decision making that is a response to their situation? So actually, it's not just about engagement and consultation, it's about engagement and involvement as we conduct our affairs from the positions of maybe statutory roles, but in partnership with our voluntary community sector, other stakeholders, and very much those with the lived experience of living in our communities, particularly the voice of children and young people. And that can take place when we're talking about environmental design and new builds and designing in a regeneration of a housing development, in what you might do within your estate, your council estate, having the voice, because these are where people are living their lives, right? And how can it be that other voices who don't have that liberty know more about their experience than they do? So it's about how do we facilitate those kind of processes to be much more inclusive. Therefore, whatever response or solutions that unfold are actually better responding and not at a dissonance with actually improving people's lives.
Geeta.
I'll just say a couple of things in addition to that. So in our borough, 37% of our population is under 25. That's 37% of our population who will be our future population. And, you know, our children are future leaders. They are the future of our country. And I think, you know, we almost minimize the value of their input and their voice because we give them that, or their young people or their children. And so, you know, we set up this thing called Next Gen Newham, the next generation of Newham, who are going to genuinely be, you know, participating in all the things, you know, Jacqui and Maureen talk about co-design, work with us on the things that they felt were really important to them. And we did this over the COVID 2 years, and young people talked to us about youth safety. They talked to us about employment, education, and really their future. I had 9-year-olds who were telling me that they felt really scared that they wouldn't have a job. And then they also shared with us about these things about activities and things to do. And again, I went to pupil parliament and young children were talking to me about how we just want to have fun. And it's such a sad, I think, a sad state when children are telling you, I want to have fun. And so what we've done, and I'll share in the chat in a moment, there's a participation ladder, which helps, I think, professionals and everyone to really think about what genuine participation is. And it isn't just calling them in when you need a little chat and to get a youth voice in the centre. It's all the things that Maureen and Jacqui have talked about, but it's also more than that, because we have got young people sat on our Stratford Master Plan, really designing the biggest opportunity that they probably will have to create a space. And that's not to say it's a youth space, it's a space for our communities of which they are a valuable and invaluable part of. And I think if you flip that narrative about the value of a child's voice, participation and involvement in your regeneration schemes or any of those things, you really will get something quite fantastic. So I absolutely advocate for that through everything. It doesn't matter what those things are. Really think about how you do genuine participation. And then my last bit, I think the first question was that whole culture point. You know, I've heard Maureen speak so many times, and every time she speaks, I learn more. But there are some key nuggets of what Maureen says that she never stops saying. All behaviour is communication. I came away from Glasgow and I said it. And I said it so much that actually everybody in South London in the borough I worked at was saying it. And so there is something really valuable about when you agree your philosophy, when you know what it is you're relentless about, be relentless. Say it, speak it, live it, be it. And you will bring on side the people who think that's just something else. What is trauma informed? And, you know, I can't tell you how many people were quite trauma informed. What does that mean? What does that look like? We invested in the training, learning, development across all our partnership. And, you know, I've worked with police colleagues for so much of my career. And I saw police colleagues genuinely engaged in trauma informed responses to think about child first policing. And that's transformational. And I think it's those things that you have to hold on to and be relentless, really have the narrative that is about our children at the forefront, and celebrate children. I mean, I will share the work we've done in the last year. The whole of 2021 was the year of the young person here at Newham. And every week we had a story about children in the newspaper, on the social media, children telling us about the wonderful things that children are doing. And we have to stop seeing children through those different lenses. They are, you know, for me, it's that real thing about please have a childhood, you have a right. And the UNICEF stuff that Maureen has mentioned is fantastic. Again, I'll share it on the link in a moment, but so much stuff around the world that you can see is happening in terms of the UNICEF child-friendly cities and the work that's going on. That's how we do children's rights every day, all through everything we do. Thank you.
Can I ask just a very quick follow-up, which is we're talking about children, which is obviously key to success here, but we know that in terms of confrontation with the justice system, it's often young adults and people who, once they turn 18, are now treated as adults by the system, and therefore are not children and therefore are held to an adult standard. But we also know that particularly men's brains don't fully form until they're at least 26, if ever. So can you maybe address, the three of you, what steps you're taking vis-a-vis the young adults, people who've turned 18, who may have come from this difficult childhood, but they're still there. They still have this trauma that they've experienced, and they're more likely to come into contact with the justice system, and not always in a good way. Maureen.
Just come in quickly here. In Scotland, care experienced young people stay within the system until they are age 26. So if you are a care experienced young person, then you will have a right to ongoing support until you're 26 for exactly the reasons, Charles, that you have outlined, that we recognise that if you have experienced trauma at a young age, then you are going to take longer to be able to cope and to be able to continue. And from the school setting, we've been working in Glasgow across our colleges, so that transition from school into college or school into university is smooth. So we have staff who work across both schools and into colleges. So the young people who are at high risk are flagged early from the school side, and then somebody follows them. So they just go up and touch base with them. And Geeta mentioned the importance of mentoring. That one good adult in a child's life cannot be underestimated. And we run mentoring where adults come in and work with our young people. I am a mentor, and the young man that I mentored, I'm on my second young person, but the first young man is now 2 years into college, and he still sends me a text when the going gets tough. And you know, he lives at home, he's got a mum, he's got grandparents, but he still gets in touch and says, "Oh, Maureen, help, I just feel really stressed," and he just needs that little calming hand. And we, you know, I haven't met with him for 2 years, but I've spoken with him on the phone. I go online with him, and I try really hard to be his one good adult. And there he is now. You know, I think he'll be 19 now, heading towards 20. And you know, you need that continued contact, one good adult in a young person's life.
Thank you. Geeta?
Sure, and relationships are the key to everything. It's almost about, you know, who are those trusted adults in children's lives, and I think that's how you do it throughout the life course. So in my previous authority and here, we have always talked about children under the age of 25 as being children. Now, I know if you were 21, you wouldn't want me to call you a child, but in the way in which we have set out our strategies, the way in which we talk about adolescent sort of exploitation, we have said it's all children, all people, young adults under the age of 25. Now, that's quite an important statement. So it's that point about we have all committed to it. I'm not saying it's as simple as that, because as we know, there are different legislative rules around, you know, being over 18 and being under 18. There are, of course, some of these what we call cliff edges around services. So, you know, children's mental health provision has a very different kind of criteria and threshold to adult mental health provision. So there are these touch points and, I guess, challenges when you say that everyone under the age of 25 should be treated in the same way that we would treat any child. But the principle still stands. And I think what we've seen in London, so we commissioned a thing called Rescue and Response, which is a pan-London county lines provision. And we had the same narrative around child under the age of 25. And what that just really has meant is that staff who see those vulnerabilities and see those younger adults who need that extra support, they're just able to do whatever is required to support those young adults. And I think, for me, that has just opened a door that says, just do it. We know what the right thing is to do, and we are enabling you to do it. And through this project, we have been able to support a lot of young children and young adults who I think may well have found themselves without services in the same way. So my kind of challenge is, I think, if you make the statement and you agree that every child under the age of 25 deserves the same service response and support because they are seen as exploited and vulnerable, then you have to move the resources and the services to align to our principles. But I wouldn't say it's straightforward or easy, but I certainly would say that's how we're approaching it. Thanks.
Jacqui, do you have a response? You're muted.
My middle name. So I would say that it's really important to have all age friendly cities, really, at the end of the day. That's really where we need to kind of get to, like, across the life course. What a wonderful world it would be if we could really generate that kind of environment. I think there are particular additional efforts that are being suggested that I think is quite right for our children and young people that have gone through difficult sort of like life journeys and experience psychological injury along that kind of journey. Another word for trauma-informed, I suppose, psychological injury. And so we make an extra effort with the levers that we've got available to us, from my world, very much sort of like politically, to attend to those barriers that they might have, that mean that their access to opportunities in order to advance and progress in their lives are that much more reduced, and they are less hopeful. So for me, through our strategies, particularly around our economic resilience strategy for our borough and our employment and skills strategy, is making sure that we prioritize certain groups, and these, one of our key groups, are around this particular cohort that we're speaking of, so that we really work hard to prioritize building work experience, apprenticeships, and other pathways that will be available to them in terms of employment support, mentoring, and developing and supporting them in their skills and confidence. And I think the other feature that I want us to sort of like really consider just on this is that these cohorts have a demographic kind of nature and character that we must also attend to. So in terms of their racialized experience, their age, their gender, their sexuality, their disability, including learning difficulties, or, you know, all of these interacting with one another create differential experiences that we are also responding to in terms of how they are able to access opportunities to flourish, or stay reduced, feeling quite reductionist that there's only one route for them to travel. So actually what we're saying is that we have to drive hard to create alternative routes and pathways for their lives that is actually easy for them to access.
Yeah.
Thank you. We don't have much time left, so I'd like to just make one pivot to address one issue. Graham Robb has put a few questions into the chat. I just want to focus on one of them, because we could spend another hour and a half on all of Graham's very thoughtful questions. Graham is a longtime educator, but he asks in one of his questions, I'd like to focus on working with the child at the enforcement end of the spectrum, as Geeta described. How can this approach with child, family, and enforcement agencies help them to make better decisions? And if you can consider that question together with a question that was asked immediately after by Helen Maunder, and Helen is the local policing coordinator for the National Police Chiefs Council in the UK. And Helen, would you like to ask your question, or would you like me just to read it out? Helen? I will read it out. And she asks that there requires a join up and network across government departments to ensure a clear understanding and delivery of what we mean by the public health concept, and how this transcends across agencies, both at national, strategic level and local. So sort of looking across agency, whole sector approach, and looking at that the question from an enforcement viewpoint. And how you're working in your communities, because you've done this sort of justice reform, as it were, in your respective communities, not from the traditional justice sector, but it requires coordination with the justice sector. So if you might speak about that nexus. You all have puzzled looks. Geeta, oh, Jacqui, go ahead.
Sorry.
And these will be maybe your final comments as well.
I sort of want to come at it from a different direction and sort of introduce an empowerment of our communities that are actually the ones that are living and experiencing some of these challenges. And so often I think that it's the easier route is to speak from a system perspective that almost sometimes really makes invisible the families and the individuals that are going and the communities that are going through these experiences. So I would just like to elevate that voice as part of how we understand what a public health approach is, or a whole system approach, because often that kind of like gets reduced. And for me, that's the most important role, because I don't believe that we can make the level of transformation for our children, young people and their families and those communities in relation to this agenda without the additional capacity and co-ownership of the agenda that comes from our community's participation. That's the thing I kind of want to come in at a different direction with and elevate that status within this dialogue, if I may, within this discourse, elevate the consumer discourse, so to speak.
Very important, thank you. My apologies to Helen, because I see she was trying to unmute and it was not letting her unmute. So she was trying to ask her question, but I'm sorry, I've asked it for you. So Geeta, you were mentioned specifically, so let you respond.
No, sure. So, I mean, obviously, I absolutely agree with Jacqui. If we don't start from that first principle, then, any flowchart or system is, it's pointless and probably doesn't work in the first instance. I mean, what I would say is that we have in the UK, we have sort of some legislative drivers around this. So Crime and Disorder Act, states that we have a statutory responsibility with some key partners to basically support crime and disorder and antisocial behaviour. And whilst that sounds very simplistic, at a local level, what that has meant for many years, since 1998, was that partners come together and we have these conversations about how are we going to work together on any of these challenges. At the local level, I mean, we do a couple of things. I've talked about trauma-informed support training that we did for the multi-agency partnership. We have done a lot of cultural competency learning across the partnership, because I think, there are different agencies at different phases and stages. We talk about the court system, I think is probably worth mentioning here as well. We've done some training, learning development about what reports that go into court, how they can be biasing some of the decision making that's happening, some of that language that we've all talked about this evening, that narrative about, don't put in words that inflame, that over complicate, might make the child look risky, or any of those sorts of things are quite easy to do in this kind of environment. And we've done a lot of that, taking away ethnicity in terms of writing that on the front page. It's the content, it's not, it doesn't really matter. And I think, for me, the thing about London versus national versus local, Jacqui will say the same as me, at a local level, we know and we are more connected to our local communities. And so you have to really ensure that the local has a voice. But we do need to work with some of those regional levers, because, again, Met Police colleague on the call, or police colleague, but, for the Met Police, they are a big beast. They run across London, so what happens at local level sometimes doesn't necessarily match what's happening at regional level. So we have to try and marry those things together and work with our partners to support them. But, absolutely, as I said, I think partners, when they understand what it really means around the child's rights, they have a connection to children. So they will do and try and work through how we make this happen in reality together. Thank you.
Thank you, Geeta. Maureen, the first word you had, and I give you the final word.
Thank you very much. I suppose it would just be to ask people to look at the children's hearing system in Scotland, which runs for children, and it's members of the community and people who volunteer to be part of it to support the decision making around the child, recognising that, you need the community voice, you need the lay person's voice, dealing with children around, and it's not about enforcement, it's about meeting the needs of children.
Terrific. I wish we could just go on, but I'm conscious of the time, and I thank all of you for spending the last hour and a half with us. We absolutely welcome policy leaders and innovators to get in touch and join us as we expand this initiative's reach and impact this year and into the future. And we, in particular, seek public officials who are in instrumental positions to implement reforms or who are seeking ideas that could be adapted for their own jurisdiction. So please get in touch, whether you are here live or watching this later. Our next webinar in this series will be in 2 weeks, minus a day, so Wednesday at the same time. And this will look at data-driven criminal justice reform. Strong evidence bases are vital for successful reforms, as we've heard today. A vast array of data are being collected in many jurisdictions by various bodies and for the advancement of multiple interventions. However, the data collection is often hindered by limited resources or political agendas. So a consistent database message can be translated for policymakers, communicated to and understood by the public, which is a key component of successful reforms. So we'll be looking at different approaches to data. I see that one of the people who's joined us today is Michal Gilad. She will be one of the featured presenters in 2 weeks, along with a couple other fellows. I'd like to, before we close, give thank yous to our partners, the MacArthur Foundation, the Harry Frank Guggenheim Foundation, and the David Rockefeller Funds, to Maureen, Geeta, and Jacqui for giving us such an enlightening discussion today, and the rest of the team at Salzburg Global Seminar. Antonia Bemeke and Helia Nazari have really been making things work in the background with one unmute problem, which sorry about that. And Ben Glan, who joined us, who is our Vice President and Chief Operations Officer, who's been involved from the beginning in design of this multi-year program. A reminder that a recording will be available and posted within the next few days, and you'll all receive a copy, and it'll be online. There are ways to engage with us in the future. You can follow us on Facebook. You can subscribe to our newsletter, where a link will be put into the chat, and that will notify you of the next webinar and the other programs and projects that we're up to. If you'd like to get engaged in this initiative as it moves to the next phase, please let us know as well. And if you know officials or social entrepreneurs or anybody who would wish to benefit from small, specialist, off-the-record interactions that might help them consider reform opportunities in their own jurisdictions, or who themselves have innovative examples to share, please also connect them with us. So with that, thank you very much for joining us today, and we look forward to seeing you in 2 weeks or in other programs and working with us as this initiative moves forward. Thank you very much.